A healthy and productive population will enable Jamaica to meet its development goals, and the Ministry of Health is working to advance this mission during the 2014-2015 fiscal year.
Our objective is to develop a patient-centered healthcare system that can serve the needs of all the local population and also as well as a global clientele.
A patient-centered healthcare system cannot develop without the proper infrastructure. So, an implementation strategy for primary healthcare renewal is being developed to strengthen the health systems. $268 million has been identified to fund the second phase of works on the 4 centers of excellence. Financing options are being examined for a feasibility study on the construction of a child and adolescent hospital in Western Jamaica. And a plan is being crafted to develop the corridor from Negril to St. Anne for health tourism and to provide trauma care services for foreign nationals. To improve patient care in public facilities, the ministry is creating a comprehensive national health information system. As part of that, work on an e-health strategy has started. Meanwhile, a pilot electronic patient administrative system EPAS is being rolled out in the 4 centers of excellence and at 4 regional hospitals. And distribution of the new GOJ Health Card, which was launched in January 2014, will expand to allow for linkages with the EPAS.
For the first time, we'll be able to track patients through the health system no matter which facility they visit. We'll be able to improve operational efficiency, the collections of fees from persons with private health insurance, and reduce wastage, especially in the way we dispense medication.
Full introduction and use of the GOJ Health Card in all public health facilities is expected by the end of the financial year in March 2015. Pharmaceutical and dental care are also getting the government's attention this fiscal year. Takeover of public health pharmacies by the National Health Fund, the NHF is moving ahead, bringing major improvements to service delivery, while several pharmacies are being renovated.
The transfer of human resources in process, Mr. Speaker. We are revolutionizing pharmacy service in Jamaica to be technology-driven, customer-focused, efficiently managed. And that this country, Mr. Speaker, this is a service that the country has yearned for.
Meanwhile, regulations are being developed to ensure only licensed practitioners can own and operate dental surgeries and laboratories. And the administration wants to make continuing education mandatory for all categories of dental professionals. The Health Ministry is implementing a program for the reduction of maternal and child mortality with $2.6 billion in funding from the European Union. The 4-year program will establish and equip maternal and newborn high dependency units.
The aim is to reduce maternal and child deaths in keeping with Jamaica's commitment under the Millennium Development Goals.
Guided by the National Plan for the Prevention and Control of Non-Communicable Diseases in Jamaica, the ministry is employing strategies to reduce the major risk factors for NCDs.
Jamaicans need to understand that NCDs are largely preventable. They are, for the most part, driven by widespread exposure to 4 common behavioral risks: tobacco use, unhealthy diet, physical inactivity, and the harmful use of alcohol.
So, the ministry will be scaling up its community health aid program in collaboration with the NHF to get greater response at the community level. There's also a partnership with the Education Ministry to reintroduce compulsory physical education in schools. To promote proper nutrition habits, the ministry is partnering with the food industry to put proper labeling standards in place and provide better information on portion size.
Cabinet has already approved the infant and young child feeding policy, and the food-based dietary guidelines for Jamaica has been developed and is being pre-tested, Mr. Speaker. The National Food and Nutrition Security Policy, done in conjunction with the Ministry of Agriculture, has been fully debated in this Honourable House.
Meanwhile, various stakeholders are being consulted on a national alcohol policy, and a national coordinating mechanism is to be established to create a comprehensive Tobacco Control Act. In this fiscal year, the Health Ministry is also looking to improve Jamaica's response to cancer and HIV/AIDS. Dialogue is being advanced with the International Atomic Energy Agency for the reintroduction of the nuclear medicine technology to diagnose and treat cancers. Tracing and monitoring of cancers will be done using the established National Cancer Registry, and systems of cancer care, emergency pre-hospital care, trauma and emergency medicine, and chronic disease management will be developed through a partnership with the Sunnybrook Health Science Centre out of Canada.
The Ministry of Health is procuring 2 linear accelerator machines. The introduction of the linear machine should reduce the cost for a full course of radiation treatment from $1.8 million to zero for the poorest and most vulnerable Jamaicans.
Meanwhile, to ensure greater care for persons living with HIV/AIDS, the National Family Planning Board is being integrated with the National HIV/STI Program. The Ministry of Health on a mission to provide quality, accessible health care for all.